Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Vibrio cholera resilience and chronic diseases. Vibrio cholera causes cholera, and you have at least two biotypes and many serotypes. The cholera presentation is like when people start having serious diarrhea, vomiting and diarrhea, where the description of the diarrhea is called rice watery. The diarrhea present like a watery rice that is now being pulled, watery rice to diarrhea, and you now experience serious dehydration, and if care is not taken and it's not the person is not rehydrated quickly, there is that problem of having the shock, volemic shock, kidney packing up, and eventually losing the patient. It is a very serious problem those days, over many years ago. But these days, you have the treatment that is just a matter of getting the person rehydrated. Once the person is quickly rehydrated and antibiotics are given, the person becomes almost normal again. And if it's more serious than that, then there is that intravenous rehydration injection that is given. But when we look at the problem that it has been on for many years, over 150 years that it has been diagnosed, that Vibrio cholera has been diagnosed as a causative agent. How come it has not been eradicated? Because the mortality rate was very high. You lose people easily to diarrhea those days because there was no understanding that is just to rehydrate the patient and also probably correct the antibiotic to take care of the Vibrio cholera itself. But how has Vibrio cholera been able to persist? The resilience of Vibrio cholera is what I want to examine in this video. That resilience has to do with the Vibrio cholera itself being able to mutate. It produces a mutated gene. For example, there was a study in Haiti where the Vibrio cholera tore the biotype and the serotype agava was really imported in there and with time eradicated, so to speak. But what was now realized is that this Vibrio cholera serotype agava now mutated to the serotype Innova, and that seriously allowed the pandemic or the epidemic of that cholera to start all over again. So it is now seen that cholera, the Vibrio cholera in itself, tries as much to continue to mutate, and with the vaccines that are produced against it, if something can mutate, you can understand that it will always create a resistance. Then there is that understanding of chronic diseases as heading. They are risk factors. When you have chronic disease, it is very easy for the cholera to be devastating, because the situation you are in is a situation of where you are already immunocompromised. Somebody whose immunity is reduced cannot effectively fight against Vibrio cholera. So you have patients who have heart disease, kidney problem and co, not being able to withstand the Vibrio cholera, so thereby making the Vibrio cholera really end their life quickly. The role of the medical laboratory scientist, as usual, that I want to always emphasize on, is in identifying these organisms. If the organism has not been identified and the coming to the realization that it is the mode of transmission as well as the pathophysiology of Vibrio cholera itself, we will not be at this stage where it has been reduced, the mortality rate has been reduced to 1%. That is, but it's still endemic in areas where they have no adequate water supply, areas where the sanitation is very poor and hygiene also poor. So the WASH, WASH, is also very important in these matters, and being able to distance, so at least you are not living in a crowded environment, is also very helpful. But how do we know more? That is where we move on to the slide session, where we shall examine the resilience of this Vibrio cholera, as well as how chronic diseases help to make it sustain its resilience. The outline, objective, introduction, risk factors, Vibrio resilience, laboratory diagnosis, and treatment. The objective: to expose Vibrio cholera, effort at ensuring its continuous existence. The risk factors that encourage its effectiveness at bringing life to an abrupt end, and the laboratory diagnosis and effective treatment. The introduction. Vibrio cholera causes cholera, which present as serious vomiting and diarrhea, rise watery stool. You just find suddenly that the severe diarrhea could even cause death within a day. That causes dehydration, and it's, if not treated, result in death. Although ways of transmission, as well as the measure to prevent infection and control outbreak, became well known during the last 150 years, cholera still remains a significant public health problem in many countries, especially in Africa, Asia, and South and Central America. In addition to that, the current seventh pandemic of cholera, which started in South Asia in 1961, got to Africa in 1971, and the Americas in 1991. The America is just the South America mainly. Is still ongoing. Today, cholera is endemic in many countries. When we talk of many countries, especially Africa, and Nigeria is inclusive, in the second decade of the 20th century, cholera remained a significant problem globally. It occurs in the form of large outbreaks, such as those in Haiti and Yemen, Nigeria, the Democratic Republic of Congo, just of recent, the Democratic Republic, Egypt, Somalia, Bangladesh, Pakistan, Philippines, China, Ghana, Cameroon, and endemic disease in many countries. The risk factors. Some chronic diseases are the risk factors of cholera. So it makes them more vulnerable to the disease. That is, those who carry this disease or who are affected by these diseases. Though cholera is an acute, short-term intestinal infection, chronic gastrointestinal condition would always make people with this chronic disease very vulnerable, highly susceptible to cholera. Malnutrition, chronic malnutrition weakens the immunity, so you expect such people to be easily affected and break down quickly. Chronic kidney disease, the extreme rapid fluid loss, characteristics of cholera, causes sudden acute kidney failure. Then imagine a patient who already has this chronic kidney disease or something pre-existing kidney issue. Handle this stress on the body very poorly. It's just immediate death. Chronic heart disease is also very important if the person has this underlying problem. Severe fluid loss and electrolyte imbalance can lead to prolonged circulatory collapse when you talk of heart attack or the person has stroke or what have you, which is especially dangerous for someone with a chronic heart condition. the resilience, cholera resilience to continue surviving, and they're still very, very relevant. Vibrio cholera produces a powerful toxin that forces the intestine to rapidly dump massive volume of fluid and electrolytes. That really creates an imbalance, serious imbalance. This toxin permanently locks an enzyme, adenylate cyclase, in the on position, causing an explosive overproduction of cyclic AMP. The massive fluid expulsion strips the body of crucial electrolytes, causing severe muscle cramp, produced metabolic acidosis, and kidney failure. So you can then see if with that sudden burst, all these things happen, then any little opportunity given it, especially in a country, underdeveloped country that have water problem and sanitation problem, then it continues to survive in that environment. And that's why it is still a major problem in areas like that. So it's even a signal that there is inequality in any country where there is still cholera, because those areas are neglected, the people are neglected. A study in Haiti on imported Vibrio cholera shows that within 5 years, the initially introduced and circulating Vibrio cholera or GAWA serotype significantly shifted to Inaba serotype by sustaining multiple mutations in the WET gene, the gene known to mediate serotype shift. So with that ability, it could shift from being Ogawa to Inaba and continue its existence. This suggests that the new Inaba serotype may be replacing the Ogawa serotype in order to evade Ogawa-induced host immunity, and thereby causing cholera potentially among individuals who may previously have suffered from it. Laboratory diagnosis. The rice watery stool is collected. That stool is what is very useful as a sample in the laboratory and examined microscopically using special microscope like dark field or phase contrast microscope for looking for that very mobile darting bacteria, shooting stars motility, because it is highly motile of the bacteria. There is also rapid diagnostic test, RTD dipstick, that can detect Vibrio cholera 01 and 0139 antigens within 10 to 15 minutes. So that also makes it important. Culture could also be done where you look for the biotype and serotype so that you can really know the affecting or the organism causing the epidemic or pandemic in a situation that if it's pandemic. So these are colony that is one. And sensitivity tests will always help to know the appropriate antibiotic. It is a specialized culture medium use, TCB Hexagon, and the alkaline spectrum water is used for transporting because Vibrio cholera is very fragile to the lab. PCR assay is done to basically identify it. It's also very useful for early diagnosis. The treatment is just merely rehydrating the person because of the imbalance created through dehydration. So most people with cholera have mild or moderate diarrhea and can be treated with oral rehydration solution. However, diseases can progress rapidly, so starting treatment quickly is vital to save lives. Patients with severe disease need intravenous fluid, oral rehydration solution, and antibiotics. Countries need strong epidemiological and laboratory surveillance. That tells you the importance of the medical laboratory scientists to swiftly detect and monitor outbreaks and guide responses. Populations access to safe water. That is very important. Basic sanitation and hygiene, which the acronym WASH, is essential to prevent cholera. That's why you don't see cholera in developed countries, except where there is this displacement, or there is war, or very poor country. The oral cholera vaccine can help prevent and control cholera. There are so many videos to watch on my channel, counting over 230 videos, and you will be satisfied. Invite more people to subscribe and allow this channel to grow tremendously. Thank you for your effort.